South Africa's public hospitals are under pressure and under-resourced. But when policy dictates that a particular hospital should offer a certain service, one would expect that staff at that hospital would at least know what the service is. Not with gender reassignment surgery, it seems. Checkpoint intern Segofatso Magolejo asked the Department of Health for a list of hospitals that offer the treatment and visited the institutions to test the system. His findings are alarming.
We went undercover to Helen Joseph, Baragwanath and Steve Biko Academic Hospital to get an idea of the kind of treatment transgender South Africans get at public healthcare centres. Steve Biko, Bara and Helen Joseph are among the 5 hospitals designated by government to offer transgender services. At Steve Biko Hospital, although it took a while for the nurses to direct us to the correct place, they seemed to know about the process and steps patients need to undergo to complete the program.
Who wants the information?
I do.
We were correctly directed to the psychiatry ward where initial assessments are conducted. At Helen Joseph, some of the professional nurses at general inquiries didn't even know what the word transgender meant.
How about to transition from male to female?
Oh, bad. I don't think there's anybody but the one country. I think direct male, gay male, because of gay male clinic, we don't have it.
Okay, could you make the more?
Okay,
put a counter down.
yeah. But we don't do that, yeah. And a public hospital, we don't do that. Private.
For the hormones, I'm not on.
We have a private hospital. Yeah, public hospital.
A second nurse we encountered at Helen Joseph wasn't even able to direct us to where we could be assisted with hormonal treatment. This, despite the National Department of Health having confirmed to Checkpoint that this hospital does offer such medication.
I wonder if they don't do that at breast. I know they do like procedures there. Try at breast. Because I know they do chemicals and everything, maybe plastic surgeons and everything.
At Bara, the nurses told us they had no idea what we were on about. We requested an interview with the National Department of Health. They asked Steve Biko to do the interview. The hospital said our inquiries were not clinical and that we needed to speak to the Provincial Department of Health. The provincial spokesperson promised to get back to us, but never did. This email from National Spokesperson Popo Maja sums up the department's view. It reads, "In relation to theatre time and budget for surgery, priority is given to life-saving surgical procedures, not elective surgery. If you look at international trends, there's a longer waiting list of elective surgery than trauma cases." Joshua Sehule is an activist and health advocate at Iranti, an organization that promotes health education with a specific focus on transgender people. He says the state fails to provide even the most basic health care.
So there's still a huge gap in terms of the amount of training that doctors receive that's on gender affirming treatment specifically. But even outside of gender affirming treatment, there's a huge gap in terms of the kind of education that public health servants, that medical health providers in general receive on diversity and sexuality.
Sehule says it's time trans people were afforded their full constitutional rights.
Globally, South Africa's constitution is always, kind of lauded as one of the most progressive. It explicitly prohibits discrimination on multiple grounds, including gender and sex, and we have seen courts successfully interpret that to cover, trans people as much as, any other population in South Africa. So ideally, you would like to see trans people having the same kind of access to different services, but generally, one of the things we struggle with is, of course, the huge gap between policy and implementation.
That's all from us this week. Please do give us your feedback. Our Twitter handle is @checkpoint_ENCA and our email address checkpoint@enca.com. Thanks for watching. I'm Nkepile Mabuse.